Governor, can you talk a little bit more about your nursing home policy, where that stands, and do you have any regrets for making these nursing homes with COVID positive and COVID negative patients, fire marshals coming in and asking them to take down walls that were part of the separation? Where are we headed with this policy?
So I'm going to ask Dr. Khaldun to weigh in here. I'll just start with this. You know, this is a novel virus, and novel simply means it's new. It means we've never seen anything like this before, and we're learning a tremendous amount in a short period of time. In the early days, I often would, observe, because some of the best science was saying COVID-19 can stay active and can be, picked up from a stainless steel surface for days. That was the original science. That's what they were saying. Now it seems less certain. The fact of the matter is we're learning an incredible amount, and we are trying to be nimble and move swiftly with the best science and best information that we have so that we can save lives. With regard to our nursing home policies, we, I think have learned a great deal in the last 10 weeks. I think that if we could go back in a time machine and do some things differently, sure, there are things that we would improve upon. But every action we took was based on the best science and the best information available to protect people and to save lives. We have adjusted and made some changes, and for that part of the conversation, I'm going to hand it over to Dr. J.
Thank you. And I'll just reiterate what we said last week. It's disheartening to see the deaths at our nursing facilities. It's not just Michigan, but across the country where people are just grappling with this. We have, in the state, followed CMS guidance when it comes to nursing facilities the entire time. But clearly, there's no question we need to do more, not just with our nursing facilities, but also with our data and reporting, which we've been very open and honest about. So right now, we need to make sure that our nursing facilities have appropriate staffing so they can take care of people. We've never forced any nursing facility to take patients that they did not feel like they could take good care of with the appropriate distancing and PPE. So right now we're working on making sure there's appropriate staffing, making sure there's appropriate beds, so those regional hubs. We're working with our healthcare systems to see if they can develop what we call swing beds, so the availability of beds in the hospital for people to be in. But we've got a lot more work to do, but we're definitely working hard on it.